22-gauge Acquire versus 20-gauge Procore needle for endoscopic ultrasound-guided biopsy of pancreatic masses, a randomized study comparing histologic sample quantity and diagnostic accuracy. Introduction. Endoscopic ultrasound-guided fine needle aspiration, EUS-FNA, is the gold standard method for histologic diagnosis of pancreatic masses. Although diagnosis is achieved in 64% to 95% of cases with cytologic samples obtained using a 22-gauge EUS-FNA needle, histologic samples may be preferable. Not only do histologic samples enable more accurate tumor characterization, but they also allow molecular characterization of the pancreatic tumor, which will soon be needed for personalized therapy. Accordingly, medical device companies have recently marketed needles for endoscopic ultrasound-guided fine needle biopsy, EUS-FNB, featuring a larger caliber and/or new cutting devices. Owing to the variability of the histologic samples obtained by EUS-FNB, many series have, however, hitherto failed to convincingly demonstrate that EUS-FNB is more effective than EUS-FNA. Two different needle technologies have recently been developed for histologic sampling. The first of these, the 20-gauge Procore needle, combines a lateral bevel technology with a relatively large caliber. Two recent meta-analyses on the first generation of the bevel system did not confirm a benefit in terms of diagnostic yield, but did do so in reducing the number of needle passes required to reach a diagnosis. The second technology, the 22-gauge Acquire needle, features a cutting device that has already proven its efficacy for obtaining good quality histologic specimens in percutaneous biopsies, along with a standard diameter. A previous pilot observational study comparing the two needles suggested that the 22-gauge Acquire needle was more effective than the 20-gauge Procore needle for pancreatic tumors in terms of the quantity of the histologic sample, as evaluated by a simple, reliable, and reproducible histologic criterion, namely the cumulative length of the tissue core biopsies per needle pass. To determine with which type of needle it is possible to obtain the largest quantity of histologic material, Karsenti et al. Performed a multicenter randomized crossover trial comparing EUS-FNB with a 20-gauge Procore needle versus a 22-gauge Acquire needle. The primary endpoint was the mean cumulative length of tissue core biopsies per needle pass. The secondary endpoints were the surface area of the core fragments, the diagnostic adequacy, core biopsy obtained, and the diagnostic accuracy with each needle. Background: EUS-FNB has been suggested for obtaining high-quality tissue samples from pancreatic tumors. The authors performed a multicenter randomized crossover trial comparing EUS-FNB with a 20-gauge Procore needle versus a 22-gauge Acquire needle. The aims were to compare the quantity of targeted tissue, pancreas, and diagnostic accuracy for the two needles. Methods: 60 patients admitted for EUS-FNB in 3 endoscopy units were included. 1 pass was performed consecutively with each needle in a randomized order. Histologic material was studied in a blinded manner with respect to the needle. The primary endpoint was mean cumulative length of tissue core biopsies per needle pass. Results: final diagnosis was adenocarcinoma, N = 46, 77%, neuroendocrine neoplasm, N = 11, 18%, autoimmune pancreatitis, N = 2, and mass-forming chronic pancreatitis, N = 1. The mean cumulative length of tissue core biopsies per needle pass was significantly higher with the 22-gauge Acquire needle at 11.4 millimeters, 95% confidence interval, CI, 9.0 to 13.8, versus 5.4 millimeters, 95% CI, 3.8 to 7.0. For the 20-gauge Procore needle, P less than 0.001, as was the mean surface area, 3.5 millimeters squared, 95% CI, 2.7 to 4.3, versus 1.8 millimeters squared, 95% CI, 1.2 to 2.3, P less than 0.001. Diagnostic adequacy and accuracy were 100% and 87% with the 22-gauge Acquire needle, and 82% and 67% with the 20-gauge Procore needle, p equals 0.001 and p equals 0.02, respectively. Conclusions. EUS-guided biopsy of pancreatic masses with the 22-gauge Acquire needle provided more tissue for histologic evaluation and better diagnostic accuracy than the 20-gauge Procore needle.